issues and addressing them. We could also share data and make sure that everyone gets to see it. In that way, it reduces costs. Before it becomes a national issue, a regional issue, it must have been nipped at the bud. Thank you.
Thank you so much, Dr. Samuel. I always love how practical you are. And I mean, all your points are like very apt. We need a knowledge base. That's why platforms like about what our One Health approach. Please quickly just chip in 1 or 2 points on this as well, so that we can wrap up the panel session.
Good.
Dr. Amira, is she still with us?
Yes, I am still here. Sorry, I
Yeah.
think
Okay.
lost you for a second.
So you have 1 minute.
No,
That would
that
be
would
more
be
than enough.
okay.
I'll go straight to
Feel
the
free to
point.
take your 2 minutes. We'll make it happen.
Thank you very much. Thank you very much. So to add maybe a little bit to what my amazing co-panelists already mentioned, youth African youth are a force that can make a change. So we can, I mean, some of the solutions are to involve youth and engage them in rural agribusinesses, for example. It's which I consider as a successful strategy and a great employment opportunities. It's also important to provide financial support for startups, because youth are able to also provide. They are creative and are able to provide projects that can be beneficial locally. But I think one very important thing to empower youth is also to address some of the challenges that they face and that can represent a barrier for them. And one of the major obstacles, and I think most of us, if not all of us, starting our careers faced, is the reluctance to value youth input, which is very unfortunate, and that's something to address, because this can make a change. But also another challenge, I would say, is the lack of support and insufficient maybe incentives for youth involvement. And I think there is a lot that can come from youth if we give the opportunity, if we're given the opportunity and the chance to do something. Thank you very much. I'll hand over.
Thank you so much, Dr. Amira. I really appreciate you being, precise and within your time. It's been an amazing panel session. I mean, I have like almost 2 pages of my notes filled with, points I got from the panelists. Thank you so much, Dr. Amira. Thank you so much, Dr. Samuel. Thank you so much, Francette. It's been a nice time hanging out with you, being the moderator for this panel session. I will now hand over to, my Oga at the top, like we will say in Nigeria.
Well, yeah, don't mind her. She likes putting me in the spotlight a little bit. Yeah, I will include myself. Oh, can you hear me? Hello.
Dauda,
Yeah,
we
okay,
can
sorry.
hear
Okay, can you hear me now?
you.
Can you hear me now?
Yes, I can.
Oh, yeah, sorry. I noticed the network got frozen. I mean, that was an amazing panel session. Just like the previous presentations, there's a lot of energy, lots of opportunities, and you know, I'm beginning to think we should create like a forum out of the African Youth Dialogue. So when we're meeting next to the physically hybrid or again online, we can have like a base audience that we talk to, because we so that we don't lose all of these opportunities and everything coming together, and we can, keep up with the trend. Thank you so much, Dr. Amira. Thank you so much, Dr. Sam, and thank you so much, Transit. Despite the 9 minutes kind of inclusion, you made it, and then this a very, very valid input. Thank you. We really, really appreciate. Um, and yeah, I want to include myself in the panel discussion because it's very sweet, and I want to use my birthday to, um, appreciate what has been said so far, and also chip in that I liked Dr. Samuel's idea on celebrating birthdays and doing things in an innovative and a one else fashion rather than doing the routine thing of busting balloons and putting more plastic in the environment and taking a lot of sugary stuff and all that. I mean, uh, I always put it on my LinkedIn page most of the times. The one else is not something just for the professionals alone. If people continue contributing to the problem, we can be the solution ourselves. Imagine everybody understands that, okay, plastic is a problem for the environment, and we all stop uh, using one single-use plastic on our own without any government or something, or majority of the people stop using it. So that is one less problem for the government to solve. That is a way, and the government and the international NGOs and all of that to solve, and they can easily, redirect the resources to problems that are not our faults. Some probably infectious diseases and so on that are from nature, and we don't concoct viruses and bacteria. They're there. But plastic, we are the ones bringing that up. The climate change, the contributions are from us. So what if we do these things on our own? So it's all in us. We all have a role to play, and we should just make sure at all times that we play that role. So I appreciate what he said, and Amira was right. Yeah, there needs to be appreciation for what we are doing. For example, I can I can tell we normally struggle a little bit to get speakers and people to organize forum like this. I mean, and it's because I was watching a YouTube video a couple of days ago, and someone tried to get one person to speak on his. He's a youth, and he presents and interviews people about grant writing, getting admission overseas, and all of proposal writing and all that. And he said it took him more than a year to get the speaker. I mean, I don't think how busy is the person. I mean, I had to just shut the video off at that point, because if you if you if you waste someone's time for more than a year to get on their talk, I don't think you're interested, and I don't think you have something really nice to say. So youth involvement should be appreciated by the elderly ones. Thank you so much, everyone. So now we'll go to the we are approaching the end of this year's AYD, which is nice, and we'll go to the panel, to breakout session. And how it's going to happen, we'll take just 5 minutes to go into. Today, we are not going to assign anybody. So go into the room that you were in yesterday, and then take 5 minutes, finalize on who is going to present for your group, and we'll come back. Each group will take 3 to 5 minutes to make a presentation on what they've discussed, and we'll go to the networking session, and that will be all for 2024 African Youth Dialogue on One Health and Sustainable Livelihood. Thank you, everyone. Really appreciate your participation. So I will open the breakout room again. Before then, I'll post the attendance list here, because I understand when we go into the breakout session, coming back out, things normally get so distorted that people will miss the link. So I'll post the link and take 2 minutes to just sign the attendance before we go into the breakout session. And when we are back, we'll make that presentation, do the networking, which this time around is going to be very nice. Yeah. So let me put the link in there. What? Okay, can you all see it? What about now? I just sent in a clickable one. Oh, okay. Yeah, somebody jumped into my chat, and then All right, can you all see it now? It's clickable, so you can go direct for it. And then by the time you're back, we're in breakout session. So join the breakout session you were in yesterday. If you're not, you join the one that you received in your email. I'll be back to take presentations of the groups. Thank you. And yeah, next year there will be more and more involvement of participants. This for the remainder of the program already, it's going to be you talking, not us anymore. And which I think is a nice thing. Yeah. Well, so just to while people sign the attendance sheet, what's next? What we're going to be doing now is to make a compilation of the videos, the links that contain there and that contain resources and platforms that you'd like to join. As you all know, there was a lot of opportunities shared therein, and we'll put all that together, and the presentation slides, we'll put them all together as well in PDF format. And we will also be sharing the book from Dr. Laura Khan and also the extra PDF from Dr. Leah Thomas. And all participants that sign the attendance will receive that. We will not prioritize those that register but didn't attend. We'll prioritize those that took their time to really be present, despite it's a morning of a weekday. Ideally, we do it in the evenings, but this time, because of a schedule of our speakers, we have to move it to the morning. You took the time to still attend. We have to appreciate that by making sure you have first right access to all the resources that came up from the event. And we don't know how yet, but yeah, hopefully we'll see you in November next year. So the breakout room is open now. Join the same one you were in yesterday. We apologize deeply for the you can join on your own and join the one you were in yesterday. You have 5 minutes by 11 o'clock on the dot. We come back in, and then we take 3 to 5 minutes for each group to present the findings. Yeah, please make it quick so we don't waste time. Or if you don't know how to join or something, let us know. Yeah, there you can also post the name of the number of the group that you were in yesterday in the chat box, and I will assign you straight away so you can join to save time. Are you all able to join? Okay. Someone sent 3. Brian 1, Eunice 2. To join or post. Oh, Fernset, what is the problem? Just yeah.
I've accepted now, so hopefully I'm joining. Thank you.
All right, no problem. Thank you. Daniel, Abraham, Grace. Wait, 191.
It might be already returning us because there's less than 5 minutes.
Sorry, come again?
It might be already returning us to the main room because there's less than 5 minutes left.
Oh, no problem. I mean, I will extend the time for the breakout session, but it shouldn't actually return. Did he send you back?
I pressed accept, but I still didn't get there.
Okay, let me say, which group were you in? Did you come yesterday or you just want to join a group
No,
afresh?
no, just trying to join today. Thanks.
Okay, no problem. Let me put you in two then. Did you see anything on your display? Uh, Everyone, please join the group you were in yesterday. We have 3 more minutes. If you're done in your group, you can remain in the main hall and we'll bring everybody back. All right, we have 2 more minutes for those that are in. All right, please. All right, please, everyone. We have 2 more minutes in the breakout session. Finalize. You can round off now and then select the person that will come back to the main hall to present on behalf of your group. Thank you. Jason, go ahead.
Got it. Roger, Roger. They're gonna go with TJJ. Roger, they're ready.
All right. Um,
I want to put more fuel in the jerry can.
all right, we're good. who is representing group 1, can they unmute themselves, turn on their video and present? Group 1, are you ready?
Yes, we are. Good morning, everyone.
All right, good morning. If you can. All right, great.
Okay. So, I don't know if I'll be able to share my screen.
Yeah, we can make that happen.
All right. Or is there a way I can share the document so that
No, you can
the
share your
project?
screen now, or unless you're using a phone and you want us to share for you.
Yes, I'm using a phone actually.
What is it? What document or something?
It's going to be a PowerPoint.
Okay, send it in. In the meantime, group 2, if you're ready, you can step up. I will take that through. You can send it to my email. I'll put it in the chat box. And then group 2, you ready? Once we have yours on display, we can come back to you. Group 2. What about 3?
Yes, we're ready.
Okay, good. 2, you can go ahead, please.
Can I share my screen, please?
Yes, you can.
Okay. We'll be having 3 presenters, so
Yeah, but you have 5 minutes all the same.
okay. Abimbola, up to you. Over to you.
Okay, good day, everyone.
All right, good day. We can hear you.
Yeah, I'm Abimbola and I'm representing for Group 2. So we have 3 discussion points, and I'll be taking the first one. I don't know if I have to go through the story so that everyone can get along with
No,
it.
yeah, I mean, you don't need to go through the story. We just want the response from your group and very concise because we are looking at time.
Thank you.
Yeah.
So the question is, how can equitable healthcare access be ensured in such community for both human and animal? So we had the case of anthrax and then the human infection whereby they lost a number of people and then some animals in the community. So the question is, how do we ensure that both human and animal have access to equal healthcare? So the first thing we discussed was that we should have more healthcare personnel because in that very community, there was no personnel like on ground. So they have to be mobile. We have to have both human and healthcare personnel to ensure that they have access to these people. And then government should also support in building healthcare facilities so that whenever such issues should arise, they should always have access to these healthcare resources very close to them because our case scenario, they have to travel for like a number of kilometers before they could even access it. And then we discussed that there should be transport facilities, like they should be mobile, both the facilities, the infrastructure, and even the healthcare personnel for ease of operation. And then there should also be creation of proper handling of carcass. According to our case scenario, the man lost his animals to a disease, and to control his own loss, he had to sell it to the markets where people consumed it, and then there was mortality. There was a lot of people getting sick from it. So the public should be educated on how to deal with carcass, how to prevent contamination and also disease spread. And then there should be education on meat quality and zoonotic disease. Then advocacy programs also should be in place to help to improve health access. So for human and animal, there should be some kind of free healthcare services for them. So at least it will mitigate the effect of all this zoonotic disease and the spread as well. And then to control it again, there should be a collaborative effort to help detect and also prevent the zoonotic disease outbreak. So collaborative effort from both the healthcare personnel, the government, and the community. So the place of education, joint resources, and the likes will come in. Thank you very much. So the next speaker can continue from here.
Eunice, please, over to you.
Okay, good morning, everyone. My name is Eunice Olobateke, and I'm the co-presenter for Case Study Group 2. And my question is, what role can partnerships between governments, private organizations, and NGOs play in addressing this healthcare gap, which was noticed in our story? So our first point was resource mobilization and funding. Through the story, we got to realize that the area that was affected was poorly sourced in terms of personnel and even healthcare facilities. So these partnerships can provide resources to fund equitable healthcare programs. The funds can be used to construct more healthcare facilities and support free healthcare services and facilitate the provision of mobile healthcare services in remote areas. This is a common problem with remote areas where they have poor access to quality healthcare and facilities. So these partnerships can come about to solve this kind of problem in remote areas. Then our next point was development of a budget line shared by all partners to provide sustainable healthcare infrastructure. The government, the NGOs, the private sector, they can all come together and capture the number of areas that need healthcare facilities in their various states, countries, local governments, and they can draw up a budget that will be able to serve these areas conveniently, such that every party, everyone involved has access to quality healthcare. Then we also discussed establishing public partnership agreements that regulate how the partnerships operate and ensure that all remain committed to the goal of improving healthcare. Our next point was partnerships can implement an open and effective hierarchical reporting system. Through the story, we noticed that there was no effective reporting system. Everyone was just acting based on their own initiative, and that led to an outburst. So having a hierarchical reporting system in place for disease surveillance and risk reporting can to counter this kind of scenarios. So our last point was establish a One Health awareness task force to address One Health related issues by creating awareness on zoonotic diseases. The affected farmer did not know the impact of what he was doing. That was why he acted that way. So when we educate these locals and we educate the communities, it will be able to bring such situations under control. Then the task force can also facilitate training for healthcare workers and One Health professionals. Thank you so much. Over to the next presenter.
Thank you, Eunice. So, okay. So, thank you, Eunice. So, and to our last point, we were to discuss on how can resources be better shared, so that we ensure equitable access of these healthcare facilities. And I'll not read everything. I'll just run through and give a point on each. So, the first thing we came up with is to have policies that take up the nexus of maybe the livestock welfare, the environment welfare, and the people as well. So we should have a nexus of policies taking into account that. We also should have integrated healthcare systems that take into account both the three sectors in the One Health, that is the animal, the human, and the environment as well. I think one of the panelists has emphasized on knowledge base. So having more people being trained, not knowing only about livestock, but know about the healthcare of both the people and the animals as well can help us in solving or allocating the resources to the right sector. And also joining programs like this campaign or this conference, where you are able to learn more on how the zoonotic diseases. It's also a way of making sure that you are allocating resources to the right sector, as well maybe prioritizing the sector that is mostly in danger of causing maybe people being in terms of being vulnerable to these zoonotic diseases, so might prioritize the allocation of resources to that, and as well involving the community, not only in training them on how these diseases spread, but also helping them to know on some of the measures that can be used to prevent them. Yeah, thank you.
Wow, that's fascinating. I'm impressed by group two. This is yeah, this is capturing everything in the One Health fashion. I really appreciate that. I mean, and I like the organization of the presentation. Thank you very much. That's amazing. And that was from Priscilla, Eunice, and Abimbola. And I assume you three are from different countries, which is one of the essence of this gathering. You know, bring people together from different background because they yeah, now anthrax is not a Nigerian problem or a Kenyan problem. It's everybody's problem. And from the way you've handled these issues, yeah, we all understand the problems are not from any country. That they don't recognize borders the way we do. Thank you, Group One. You can take a go now. I am sharing screen, so you can present. Okay.
All right. Thank you very much. Good morning, everyone. My name is Dr. Ibrahim Abdulkadir. I am a veterinarian from Nigeria, and I'll be presenting case study one on behalf of the Group One. So basically, the topic we got, or the case study we got, was about a country. It was a fictional country called Wakanda. It was a middle income and was a thriving country. But because of heavy reliance on antibiotics in the human and the livestock sector, they came attacked with a problem of antimicrobial resistance, which affected the healthcare sector, affected the agricultural sector, and affected the economy of Wakanda as a whole. Now, going to the study questions about this issue in Wakanda, we had three study questions or discussion questions. The number one is, among the health, agriculture, and environmental sectors, which faces highest antimicrobial resistance in Wakanda and why? Well, basically, it was a no-brainer because among the three sectors, the health sector was shown to have faced the highest cost or the highest burden from the antimicrobial resistance problem because of the 80% increase in treatment costs, the reduction in effectiveness of treatment, prolonged time of treatment, and high rate of resistant microorganisms in the environment, affecting both the humans and the animals, including livestock. So there was a budget overrun, and the impact of the AMR on human health resulted in a loss of over $300 million in 1 year in Wakanda. So that showed to us that the health sector faced the highest hit in all of that problem. So the second, next slide, please. Okay, so the second case study was, the second question was, which stakeholders bears the greatest responsibility in combating AMR, and how effectively can these stakeholders collaborate? First of all, we need to know the stakeholders involved in antimicrobial resistance, the war against antimicrobial resistance in Wakanda as the country of reference in this system. So we had the government agencies as one of the key stakeholders, the healthcare providers, the farmers, which were likely to be the root cause of of the problem, antimicrobial resistance, because of indiscriminate use of antibiotics as growth promoters in their livestock, and then that, skyrocketed the situation to become, an epidemic in that country. So, but talking about the responsibility now, we agreed in my group that the government agencies had the greatest responsibility in that they are responsible for, creation of legislation, regulating, implementation of policies, formation of policies, and maintaining strict implementation of these policies, and regulation of, the use of antimicrobials in Wakanda, especially among the farmers and among the human patients as well. But talking about the responsibilities of other stakeholders as well, we have the healthcare providers that are supposed to, provide antimicrobial stewardship, then provide public education and public awareness for the entire public about the dangers of antimicrobial resistance. Then we have the farmers who are supposed to, start to implement biosecurity measures on their farms and, encourage responsible use of antibiotic on the farm and even restrict the self-diagnosis or self-medication and calling on veterinarians to actually handle cases of infections in their animals. Then international organizations are expected to provide technical assistance and global coordination of antimicrobial use. So now we have the third study question. Okay. How can these stakeholders collaborate? Well, these various sectors involved can collaborate in terms of forming committees for policy development and also organizing training programs for healthcare providers and also these farmers so that they can understand dangers of antimicrobial resistance and the benefits of responsible use of antimicrobials. Then all of them can join hands together to go on public awareness campaigns so that everybody in the country and in the society can gain knowledge on understanding the dangers of antimicrobial resistance and be able to take the necessary measures to reduce the menace of that epidemic. Then they can all partner in conducting research for new technologies and new strategies by which they can innovative strategies to combat this menace of antimicrobial resistance. Now going to our third discussion question, which was, considering limited resources in Wakanda, which policy measures do we think could be implemented to balance the antimicrobial control with economic stability in Wakanda? And how might public awareness campaign help change antibiotic use? Well, this is two questions in one. And then the first aspect of the question, the policies measures that Wakanda can implement includes implementation of antimicrobial stewardship programs, antibiotic use in agriculture, and encouraging the use of the responsible use of antibiotics. In fact, one policy that should be maintained is, biosecurity measures should not be an option for any farmer. It should be a compulsory measure taken on every livestock farm, so that we can reduce the rate of antimicrobial use and abuse. Then if investing in infection prevention and control, prevention such as vaccination instead of going ahead to import more antimicrobials, developing and importing more vaccines for use so that we can prevent some of these diseases that these farmers will think of using antimicrobials on. Then promoting alternative treatments and technologies. There is a new innovation now that is bactericins, and there are a lot of innovative methods that are alternative treatments to infections that can help us reduce the rate at which we use antimicrobials in treatment of animal and human infections. And then introduction of technologies and the diagnostic tools and facilities in the country Wakanda and in our various countries as well. Now going to the second aspect, now talking about the public awareness campaign. How can this help? Well, we have people in the rural areas, we have people who are not, well educated in the medical or in the science aspect, and would also, are also involved one way or the other in the use of antimicrobials. So how do we get across to these people? Well, it's simple. Public awareness in the terms of educating the public on the responsible antimicrobial use, and then importantly, the myths and misconceptions that have been circulated about antimicrobials, like when somebody is sick, and you have similar symptoms, you can take the antimicrobial prescribed for your friend, or you can go to a pharmacist and get prescriptions instead of going to the hospital. So a lot of these misconceptions need to be corrected, and people need to be aware about the dangers of antimicrobial resistance and ways by which this can come about. Then we can highlight economic and health impact of antimicrobial resistance. When a lot of people know the outcome or the impact at which this menace of antimicrobial resistance will have on them and on the country entirely, then they would implement more measures to, combat this, join the fight against AMR. Then reduction of antibiotic use is another one. Then drug regulation and surveillance can also be ways to curb antimicrobial resistance using public awareness. Well, there are a lot of other measures, but I would like to stop here for today. So let's not forget that there is need for a One Health approach, and the human, the animal, and the environmental sector need to collaborate to, fight against this menace of antimicrobial resistance. Thank you very much for listening.
Wow. Can we all use the clapping and emoji to praise Dr. Kaji? This is comprehensive. I like this one as well. And this is very, very, very interesting. And why I'm particularly really interested in this is, we have created this platform to facilitate this kind of discussion, so people to expand their horizon about the way they approach problems in their localities, especially youth in Africa. And it's obvious from the presentations we have from these two groups that everybody now has a better understanding of the complexity of one of problems from AMR to wildlife livestock interface, wildlife human interface, ecosystem balance, infectious disease, and so on and so forth. I think from what I'm seeing, all participants now have it clear in their head that, okay, this thing is, the end goal is simple, but the approach is complex. We need to bring everybody together. We need a willingness to do the work, and we need a solid approach to it that will encompass all disciplines and sectors involved, and that makes me very happy. It's an indicator that we are gradually achieving our aim with the African Youth Dialogue on One Health and Sustainable Livelihood. To close the event, we'll take a very short presentation from Group 3, if you're ready, and then we'll call it a year, and we will see you all in 2025. Group 3, you're ready, you can go.
Yeah, very ready for Group 3. I hope it is, you can see it.
Yes, we can see it.
Yes, so for Group 3, we had a very able team. They can just raise their hands using the chat button so that people can see the able group. So our case study was looking into improper waste management, particularly plastic waste, and its significant threat to the all aspects of One Health in one county or one town in Kenya, that is Mombasa County. The first question was looking into how can we leverage on plastic recycling to address environmental challenges and sustainable economic opportunities. And we were to address the visible problems. And one of the visible problems was the environmental pollution and microplastic contamination in water and soil. Then again, the harm to the marine environment and terrestrial wildlife. That is, of course, the risk of disease spread in the aquatic life. Then again, another one with regards that there is an exposure of microplastics and toxic to humans. So what are these issues is that, one, we need to adopt a circular economy framework that promotes recycling of communities so that they can be encouraged to, of course, provide or bring back the waste materials for recycling. Another policy of concern, of course, is encouraging public-private partnerships so that we see more private actors engaging in recycling of plastic materials. And another policy, of course, is enforce regulations to reduce single use of plastic materials. And this can be done by the governments to ensure that there are regulations to enforce that to happen. Another thing of concern is looking into, the contributions to sustainable developments or economic contributions to sustainable sustainable development. If we recycle plastics and we're looking into job creations or creating jobs in the market, more businesses will come up. That is entrepreneurship opportunities. Then again, public health savings that we will have saved exposure. This is part of preventive measures in public health so that people would not be sick. And at the end of the day, we will have saved money that would have gone into treatment. If we clean our beaches and our coastal lines, we will revitalize tourism, and that would also spur economic creation in the hotels, in the industry and tourism industry. Then again, we'll have market for recycled products. We were talking yesterday of some cabros that have been used for landscaping, made of tires, and this is a good way to, of course, come up with some more markets. The possible challenges encountered during implementation, of course, one, infrastructural limitations, funding constraints again. Then there is again weak regulatory enforcements, and then again another issue, of course, in terms of logistics to carry these plastics to areas where they needs to be recycled. The second question that we were asked to look into was what are the economic benefits for sustainable development and reducing public health risks, and this is again with regards to strategies that the African governments can, of course, undertake to ensure that we realize or we maximize the economic benefits. One is majorly is on tax incentives. We need to provide tax breaks or subsidies to companies involved in plastic recycling, and this will, of course, encourage more people to enter into these businesses by not having them being overtaxed, and that would also ensure that people venture into these businesses. Policy frameworks, the government need to develop comprehensive waste management policies aligned with the One Health approach to protect public and animal health. You've seen major in our towns, we've been complaining of stray dogs, and one of it is because of poor waste management in towns that would attract dogs to go and feed. But if we have comprehensive waste management policies, then again, we would have managed to, of course, control that. Of course, capacity building is another thing. Invest in training programs to develop skills and recycling technologies, and sustainable waste management, of course, to the communities. The third question, we were asked to look into the innovative solutions, and again, the role of private sector in scaling up the plastic recycling. And some of the innovative solutions, of course, one is mobile recycling units. Can we have mobile recycling units going rounds in the communities, collecting these and doing recycling of the materials? And then how can we encourage communities to form cooperatives? And these cooperatives will ensure that the communities take charge of the waste that they are producing. And this is a sustainable measure. And then again, upcycling initiatives promote creative ways to repurpose plastics, such as converting them into fashion or construction materials. I've said earlier, the cabros that are being developed from tires that have been used. The three roles of private sector in this is one, investment in infrastructure. I think the government needs to really see how can the private sector invest in this infrastructure. We know that much of the private sector have corporate social responsibilities. How can we advocate for these CSRs to, of course, support the plastic recycling, and then again, advocate with this private sector to scale up their operations and maybe adopt the small scale of businesses that they are running, and they've shown even proof of concept that they can work. How can we use One Health approach to, of course, raise awareness? And we saw the four as being the most significant. One is research and evidence-based messaging. Can we conduct operational research to identify cost-benefit analysis of impacts of plastics in the One Health space, and then use these findings to customize our messaging based on evidence-based and what we have researched? That will really support the target populations to have positive impact on plastics. Environmental cleanups, we've seen that this is something that we've been doing. Yeah, how can we really use these drives to enhance or drive the agenda of One Health approach? Not, of course, forgetting the communities, community education and engagement. The communities, the primary producers of these are the communities. How can we, of course, use these forums to drive the agenda of One Health approach in the communities that if you are producing waste, these are the...
Yeah, just
Yes,
round
and
up.
then the last one is stakeholder engagement.
All
Thank
right.
you. That is the last one, actually. Thank you so much.
Oh, yeah. Thank you very much. That was amazing. From group 3. I mean, like I said, it's an interesting thing that everyone will now come to understand the importance of stakeholders engagement, the importance of youth involvement, investment, and engaging other sectors. For example, if you have a problem with AMR, it doesn't mean that because it kills humans, that humans are the only ones affected. It doesn't mean that when animals are dying from it, animals are the only, or that you are the only one responsible for the solution or that can solve it. It's never um, one person, one organization, or one institution, or one sector that can solve this problem. So we need everybody to come together. And one trend from the 3 case studies that I appreciate is that all the participants put in so much effort to, recognize the complexity and or to speak to every aspect of these problems. And this is really, really impressive and interesting. It means, yes, on the One Health initiatives are really, really taking effect, and youths are beginning to imbibe the I would say the spirit of One Earth, but the professionalism in it. And everybody's beginning to understand to solve any problem, to create projects, to do research. You have to step out of your silo. And this will be the end of African Youth Dialogue on One Earth and Sustainable Livelihood for year 2024. I want to say a very huge thank you to everyone here for being present, for participating actively, because from all the presentations, from the breakout sessions, we can see that everybody actually put hands together in the discussions, and really appreciate that. Reminder, we have a lot of resources and opportunities that came up and we'll be sharing with you. But if you can take advantage, in the meantime, you can start, but we will make sure to send links, PDFs, and yeah, if there's any other project we are up to, we'll keep you up to date and you can be part of it. Hopefully, well, I must say we should appreciate East Africa for their participation here. We had a lot of people that registered from Kenya, Ethiopia, Somalia, and Uganda as well. And we have a lot of Cameroonians that registered. So they came after Nigeria being the host country, which is something that is noteworthy for us. And yeah, we hope that this collaboration is something huge. Probably when it goes physical, we will visit you, or we can all meet in person, right? So thank you, thank you, thank you, and see you all in 2025. And then before then, see you all on our pages where the things will keep you up to date with our activities. And you will have to be a little bit patient with us because it will take some time to process the certificates and to, compile the presentations and the videos and put them all out to you guys. We will definitely make sure we make it happen as soon as we can. But in the meantime, please join the call, go through the PDFs, and take advantage of everything that has been shared. So the tradition is at the end of every year's program, we turn on our cameras and everybody says bye-bye with cameras on, not with cameras off. So you can now unmute yourself, open your video to say goodbye. I'll go to a place where you can see my face also. Yeah, don't.
Bye-bye, everyone.
All right. From the forest, I say goodbye until 2025, unless there's one seniors program and we're going to meet. But for now, this is it for 2024. Thank you so much. Hold on, I would like to take a screenshot of the beautiful faces we have here. All right. Thank you. Until you in 2025. And yeah,
Bye-bye.
bye bye.
Bye-bye. See you in
And
2025.
then
All right.
feel free to interact with us. Send me an email if you have anything, any question about us, or if you want to participate in any of our programs. I'll be there. Thank you.
Yeah.
Bye, everyone.